Cerner's live experience. Welcome to Cerner's live experience at HIMSS 2019 in Orlando, Florida. We are streaming live from the Cerner recording studio on the HIMSS exhibit floor, where we're sharing unique and insightful perspectives from some of the brightest minds in healthcare. At Cerner, we are intent on becoming the partner of choice for innovation in healthcare, but innovation only happens through collaboration. We are at a place of immense opportunity and possibility in this industry, but our next chapter can only be as powerful as the collaborative relationships that we cultivate. Today, we're discussing customer relationship management and what that means for the healthcare industry. We're joined in the studio by our moderator, Ryan Hamilton, Senior Vice President of Population Health at Cerner, and our guest, Susan Collins, Vice President of Healthcare and Life Sciences at Salesforce. Ryan and Susan, thank you both for joining us today.
Hi, Susan. Welcome to the Cerner booth. It's our pleasure to have you here today.
Thanks so much.
Thank you for coming. And the topic of today is sort of customer relationship management, also known as CRM.
Sure.
And the topic is really how do we think that's going to impact or influence sort of the future of healthcare? So my first question to you is, I was hoping you could just start off kind of shaping the idea of CRM. What is it? What does it do? How have other industry used it? And why is Salesforce and CRM, you believe, relevant to healthcare?
Yeah, absolutely. It's a great question. I think traditionally, many people, when they think of customer relationship management, connect it to sales and salespeople wanting to understand their customers better serve their individual needs. And certainly Salesforce has a long history, both in Salesforce automation and also helping people better understand and serve their customers in a very unique way. I think that adoption in other industries now could apply to almost any stakeholder. So, for example, I'm a kind of a Marriott girl, right? And Marriott knows probably more about me than most of my family because I spend more time with them. But just things about preferences, about my travel habits, what makes me more comfortable on a Marriott property, as an example, is all kept in the kind of data that a CRM system is designed to facilitate. And we see it across almost every industry at this point. You could think about travel and transportation in addition to hospitality. Certainly all of the retail interactions we have these days are very tailored and personalized, way down market from the days of that being sort of a bespoke experience. And I think there's a lot of learning actually from other industries that can inform the way we bring CRM to healthcare. The obvious kind of focus would be a consumer experience, and how do we really tailor a healthcare experience to that particular individual or potentially a family. But I think about it also in terms of the network of physicians and other caregivers that we have in the systems who frequently are a little bit siloed, right? And we think about an experience in a hospital as an example, potentially being somewhat disconnected for a consumer. So you might be laying there in a bed, you have no idea that the chiller blew up, in the MRI room, that you're supposed to be down there in 30 minutes, and nobody kind of necessarily comes to tell you that, hey, we're just going to leave you on this gurney in this hallway for a little bit because we're having a technical difficulty. That sort of experience and the difficulty and the friction navigating that universe is, again, something that CRM can really inform. So if we have a better understanding of your individual communication preferences, what your concerns might be, what your previous experiences might have been, we're better able to address that experience in a much more proactive fashion. And I think it's a really interesting kind of horizon, pretty kind of early in the game in some cases, but where we see it done effectively, it's been a game changer.
Thank you. I actually had a weird experience coming down here in the airlines, which is,
Okay.
It should have been a terrible experience in the sense all my flights were delayed. I had to get rebooked. Sure. I didn't know where my bag was.
Yeah.
Yet Delta sort of made that seamless. They notified me my plane was late.
Yeah.
They made it super easy to rebook.
Absolutely.
And when I landed in Orlando, it told me exactly where my bag was and which baggage it came off of. And it was a nice personal touch, which actually made it sort of an enjoyable experience, what should have been an otherwise sort of terrible day.
Absolutely.
It was actually pretty pleasurable. As you think about healthcare as a new segment or vertical for you
Sure.
guys, what are the most common challenges you're seeing in healthcare that you think your technology can help increase both the business outcome for
Sure.
organizations and or the consumer experience around both patients and members?
Absolutely. I think the sort of obvious component is things like social determinants, right? Now, this is not a strange word in healthcare, and we know that so much of an outcome could be dependent on what is that individual's access to transportation to get to a follow-up visit. Do they have other challenges in their life? Do they have a spouse with a kind of more concerning condition, which is the priority in the family, that can lead to non-adherence and those kinds of things? And certainly understanding that bigger picture and understanding that individual in a much more holistic way is helpful when we're treating them through some sort of episode of care. But that's also the way you develop a relationship with a consumer, with their family, and become a more integral, potentially more proactive part of their healthcare journey. And I think that's the most exciting component of of kind of this new horizon, if you like, in healthcare, and where the Cerner and the Salesforce collaboration, I think, is really powerful, is that we have all this insight now, right? We're no longer just awash in the data. We know a bit more about what we can do. Having the ability to traverse that last mile problem of actually making that actionable in the real world, and being able to measure that effect and create a bit of a learning system so that we get better and better and better at delivering that kind of activity, I think is really powerful. It's very exciting.
So one of the key areas we hear a lot about is patients feel like it's hard to access the healthcare system or to navigate during the handoffs or different transitions. Yeah. How do you see the Salesforce type CRM technologies being used in those modes?
Sure. So we think of our technology as an engagement layer. So you have systems of record, right? And we have these in every industry. Even you think about a manufacturing environment with some, kind of back-end systems, got tons of data, maybe potentially useful data that's difficult to access in the moment, right, in an interaction with another stakeholder, a customer, or what have you. Healthcare works in very much the same way. And I think the ability to create, ideally, a single pane of glass from a customer service perspective, now whether that's clinical service, social service, what have you, is a really, it's a big accelerator to creating a much more seamless experience and allowing people to have an access experience where we can be proactive and reach out to you to say, here are your gaps in care, for example. Yes, you called us for directions, or you had a question about a bill, or what have you, something somewhat mundane. But being able to say, while I have you here on the phone, for example, here are some other things that we could do to assist you to make your journey more comfortable, or to be more proactive about your health. And I think that's really an interesting avenue to explore for many different systems.
How does organizations that you've experienced think about sort of the CRM as part of their brand identity? Is that a big play for them? Are those very well linked? What's been the sort of interlink, not just from a patient access or clinical delivery type mechanisms, but at sort of a corporate level, is that playing a big role in their decision making as well?
I think it is. I think that's exactly right. When you think about how systems are becoming more active participants in their community and really driving a lot of value and guiding people in this much more proactive and health-oriented environment, the ability to deeply understand a customer, of course, is going to inform a brand. And the ability to express that brand and what your value proposition is to the community that you serve, I think, is also very powerful. And it really, the days of just sort of, hey, we're going to do a bunch of marketing flyers and we've targeted a zip code and everybody's going to get the same kind of messaging, those days are over. Consumers are just inundated with, it's a lot of noise, right? Rising above that noise, to have a brand proposition, if you like, that resonates with your consumers is really powerful.
Yeah, you sort of equated it to marketing. How does Salesforce actually help you in conversions, as they would say? So how does it assist an organization in knowing whether that's effective and measuring the value of those campaigns? Can you describe that a little bit?
Sure. Again, one of the other things, the days are past where marketing was just considered a little bit of an, black magic, and, we'll know it's good when we see it. Marketing is very sophisticated these days, and so measuring reach and access and results, now that's really a technology problem to solve. This is where I think healthcare can take some lessons from other industries that have been doing this for a long time, and really leveraging the analytics behind the technology, right? So you gather more and more data about what resonates, and it's much more sophisticated than the old A/B testing. Do we say, hey, it's Breast Cancer Awareness Month, or hey, we have a screening program, and be more specific? You can really get down to a very fine point with the demographics and the messaging that works for different populations. And then I think the ability to literally in real time adjust that message as you're capturing the data around whether or not it's resonating in the market is really important.
How do you see health organizations, and that could be health systems, it could be clinically integrated networks,
Sure.
it could be coming from more of the health plan side of it.
Yeah.
How do you see them adopting the technology? Are they making more spot decisions, enterprise decisions? Are they what's sort of their adoption? Where do most organizations start? What would those organizations counsel other organizations as they think about their CRM
Sure.
journey, how to get started, and how to get to value quickly?
Yeah, and I think that's a really critical question. Getting time to value is a really important, obviously we're under some reimbursement pressure. The models are changing. That brings some uncertainty to the discussion. It's interesting to see the different points of entry that hospitals and health systems make when they adopt this technology. Frequently we see it in a contact center environment. There's a need to do a better job engaging with the consumer at that point of access. Sometimes it's also in the service line marketing environment, things of this nature, where there is a strategic initiative around a population health effort, something of that nature. Those are things that make a great deal of sense and are kind of quick wins, if you like, from a technology perspective, and the ability to make a big impact quickly in a measurable way is pretty straightforward. Not an easy undertaking. Lots of times it comes with some organizational change. I think the planning for that is something that I've heard our customers advise others to consider carefully, that it's not just the implementation of technology, but the preparation within the organization that makes for a successful implementation.
Yeah, how do you see the pace of adoption of CRM in healthcare? I mean, if I was here 5 years ago, I probably heard very little about it.
For sure.
It seems to be one of the dominant
Yeah.
themes now is sort of the CRM tools and products and services mature relative versus adoption. Kind of talk about is healthcare ready? Are the tools ready? And are you seeing good progress with the early adopters and early clients doing it?
I think so, and I think you're right. 5 years ago, people had the head tilt problem. It's like, Salesforce, healthcare, help me, I don't understand. It was the analyst community actually who figured it out first, and we talked about creating an enterprise platform to help organizations position themselves to meet consumer expectations, and we know that those are exploding right across every industry. And healthcare, frankly, is just not able to get a pass on that anymore. The days of parking somebody in a waiting room and just waiting until the doctor was ready, those days are over. People won't tolerate that anymore. And we've gotten better and better and better at that patient experience, and it's become a differentiator in many markets. I do think it is, to your question earlier, an enterprise decision. We see much less of the siloed kind of best of breed approach, somewhere off in some corner of the organization. These are technologies that really support the entire business, and whether you start in the contact center or in marketing or somewhere else, the ability to connect all of that data throughout the enterprise is really powerful, and I think people do understand the value of that now.
So very much having an enterprise sort of vision and strategy,
Absolutely.
but starting with consumables
Sure.
bites that
Absolutely.
you can get to ROI pretty quickly.
Absolutely.
As you think about it. So let's talk a little bit about the partnership with Cerner.
Absolutely, yeah.
I can talk a little bit about what it was from our vector, but
Yeah.
as Salesforce and us discussed that, from sort of your perspective, what's the value of the relationship with Cerner, and then what's the nature of that? How do you see that as a win-win for our shared clients?
It was a very different partnership than maybe we've had in the past. Salesforce had a long kind of history of developing a partner ecosystem. They were more typically what we would think of as traditional ISV arrangements, and we have many thousands of those partners. This was much, much more connected to our go-to-market strategy, how we see ourselves playing in this space in the future, and being able to accelerate the technology in market. And Cerner obviously has such a dominant share in this space. We thought that the way you went to market with a healthy intent, for example, and the focus on being EHR agnostic and having this amazing capability of deriving insight from all of this data, kind of regardless of source, was such a great fit for our ability to execute on that insight. And I call it traversing that last mile, solving that last mile problem, and taking action at the point of care. And it just seemed so synergistic, really, to use the overused word. It was a board-level decision at Salesforce, and it's something we're really proud of and really excited about.
Yeah, I would give it's pretty equivalent on the Cerner side,
Yeah.
right? So we had come at it much more from a history of an EHR,
Yeah.
and then as one of the market leaders in population health, how do we actually build longitudinal data and organize communities of resources
Absolutely.
around the individual, not just the health system or an individual practice. And then we had extended that into sort of not just thinking about patient engagement or member engagement, but how do you engage the individual in their lives?
Sure.
And so we'd done a lot of work. The value prop to us was really, if you think about other industries, they actually touch you not only through their app,
Yeah.
which is a good strategy,
Sure.
but they can touch you in their daily lives, right? I didn't have to go find my bag when I landed in Orlando.
That's
It
right.
reached out to me in my life as I was
Yes.
traversing the
Yes.
airport and just told me where to go. So the sort of continuous contextual nudging, and how do we do that, as well as personalizing all the interactions at the enterprise level, we saw as a big deal. Now, a lot of the conversation to build on that has been talking about sort of CRM and the customer, the patient, the member, the individual. How do we see it? How do you guys see it playing in other stakeholder roles? So increasingly, health systems are getting more complex.
Absolutely.
They're dealing with ACOs backed by clinically integrated network, extended networks of provider, some owned, some affiliate. How do you see those tools or your tools being used to help manage those network of providers, as well as sort of the consumer side?
Sure. And I think, it was funny, I was at a breakfast, there was a great speaker this morning, he was talking about exactly that, and they have, it's about 4,000 physicians, and this was a technology guy who had come in and was appalled to find that they were managing this network on an Excel spreadsheet. And he said he walked in and he just mind blown, right? And he was like, help me understand this. And they said, no, it's going to be fine. We have this project underway and we're going to move it into an access database. It's going to be fine. And he said, we're sitting there in this boardroom and, people are arguing over who has the latest data and, who's responsible for updating it. And how do we onboard new providers into the system and who knows when that happens? And they did deploy Salesforce. It's actually a great story. They've been using it for about 4 years now. But to talk about the difference in that onboarding experience and being able to have access in real time and proactively identify where there might be white space or gaps in a community, other industries would look at that and just shake their heads, right? But it's an evolution. It's a different way of doing things for healthcare, and it's growing like crazy, which is exciting to see. And I think we'll see more sophistication in that area going forward.
Yeah, Cerner's vector on that is very similar, actually, which is, a big topic of conversation is physician burnout.
Absolutely.
And just the amount of work they're expected to do. And so, whereas we look at it, how could we use those tools to help personalize and nudge them? How do we give them the right information at the right time? It's not always just a model where they have to go into the solution or the application, but can we reach out and remind them contextual at the moment, removing much of the cognitive burden to do the right thing at the right time, and we see as a big opportunity as well.
I think so. That understanding someone's individual preferences around how they practice is really important. We've had a lot of standardization. I think for the most part that's been a good thing. The way we've implemented technology in healthcare has been hard on our clinicians in some respects, in terms of they have access to all of this data, but they do have to generally go looking for it. And it's presented in a way that someone else has decided, as opposed to the way they might have personally elected to keep that information or access that information. And, I had somebody talk to me once, kind of in a hospital corridor. He was holding his head in his hands, and he was in implementation, right? Tough time. And he just said, everywhere else in my life, the word upgrade is a good thing. He said, and in our space, when somebody says the word upgrade, I just want to go to the top of the building and throw myself off it. And, our ability to solve for that is really important. We have these people who are doing really, really important work, literally life or death sometimes. We need to make it easier for them.
That's good. As you see people adopting CRM tools, particularly Salesforce in the industry, what are some key considerations at a leadership team or at an enterprise level they need to think about? I mean, an obvious one would be, how does that fit into their care redesign? So to what degree can you remove the manual labor and the burden on people and do with automation? But what are just sort of the categories as a health system or an integrated network thinks about adopting these tools that they they'd want to think about as part of their strategy.
Yeah. I think it's really important to think about it as part of the enterprise strategy. And there's always that inclination to do a project in isolation, particularly if there's not familiarity with the technology and somebody wants to dip a big toe in the water. And that's fine to do it as long as it's part of that enterprise vision. And to make planning for that a big priority, and to really understand from an organizational perspective, what is it that the organization wants to improve, right? It's not necessarily just digitizing the existing process. We're going to move it out of Excel and we're going to put it in, a CRM tool, but really being very thoughtful about what that design ought to look like. What's blue sky? What would be, what would be better? And, can we plan for that? And the other thing I think it's important to be thoughtful about is how those projects get staged, right? Mm-hmm. Based on the resources that are available and kind of the organizational appetite for change. Change can be a little bit difficult sometimes, and I think presenting this in a way that has really user-centered design at the center of the design process is really important. Really understanding what your front line looks like and what it can look like, and being thoughtful about that is really important.
So thank you for that. It's been a wonderful conversation. As you look
it.
ahead, what do you see as the key sort of next milestones for CRM in healthcare? Like, what are the big ideas you see coming, or you would like to see coming? What do you think's on the horizon?
I think our ability to be proactive is really exciting. We talk about getting out of sick care into true healthcare, and I think that is closer than we sometimes think. And I think the opportunity to help people understand how to access care in a much more proactive way, the focus on prevention, the focus on value, whether that's a shared risk arrangement that's kind of pushing it from an economic perspective, or an outcomes-driven initiative where you have goals for a particular population. We're getting so much more sophisticated about our ability to do that and do that very well. And we get a lot of learning out of that process. And I think it's an exciting time to see how much impact that we can have from that perspective instead of waiting for someone to show up in an ED.
Right. Yeah, it was interesting. It's a quote from a client I met yesterday who described the consumer as the most underutilized resource in healthcare.
Oh, for sure. That's
and
great.
You're seeing movement both at the federal level,
Yes.
with SEMA and them yesterday.
Yeah.
I think this is a key piece to that. I mean, if you look at what the digitization and other industries has actually done, most of us can self-service. In 30 seconds or less, we could all check our bank account, we can book transportation,
That's right.
we could book a flight. Why can't I access healthcare in the same way?
Absolutely.
And to what degree can those tools nudge me, adhere to my therapy, help me develop the right healthy behaviors? Thanks for your time today. Sort of the parting question would be, is if I'm an organization, this is very interesting to me, how do they get started?
So clearly, we'd love if they would reach out directly either to Cerner or to Salesforce, and we're happy to combine forces and address whatever business problems they're trying to solve.
Well, thank you for your time today. It's been
pleasure.
a wonderful discussion.
Thank you so much.
Hope to see you again in the future.
Absolutely.
And let's go solve problems for healthcare.
Absolutely.
Thank you.
Let's go do it.